Hey everyone, and welcome to your PTCB Prep Guide. Today, we're going to test your knowledge on hematology and coagulation with some real exam-style questions. Let's sharpen those skills and get you ready for the big test. All right, so here's how this is going to go. I'll pop a question up on the screen, read out all the options for you, and then you'll just pause the explainer to think about your answer. Then, whenever you're ready, just hit play, and we'll go over the correct choice and exactly why it's right. Ready to get started? Awesome. Let's kick things off with Section 1, a review of some common anemia medications. You know, these things pop up on the exam all the time, so let's make sure you got them down cold. Okay, first question up. A patient is prescribed epoetin alfa. Which condition absolutely must be monitored closely? Is it A, hypotension, B, hypertension, C, bradycardia, or D, hypoglycemia? So go ahead, hit that pause button and think about your answer. Okay. You got your answer? The correct one is B, hypertension. So what's going on here? Well, epoetin alfa works by stimulating red blood cell production. But when you have more red blood cells, it can actually make the blood a little thicker, which can cause blood pressure to go up. This is one of those classic high-yield facts for the PTCB. You'll definitely want to lock this one in. All right, on to the next one. Which anemia medication is known to cause dark stools and constipation? Your options are A, cyanocobalamin, B, folic acid, C, ferrous sulfates, or D, filgrastim. Take a sec, pause here, and lock in your answer. And the answer is C, ferrous sulfate. Yeah, if you've spent any time in a pharmacy, you've probably heard this one from patients. Iron supplements are just notorious for causing those GI side effects, especially constipation and those really distinct, dark, almost tarry stools. The big takeaway is to always connect ferrous sulfate with these issues. Okay, next question. A patient has neutropenia after chemotherapy. What are they most likely going to be prescribed? Is it A, epoetin alfa, B, ferrous sulfate, C, filgrastim, or D, oprelvekin? Go ahead and pause. The correct choice here is C, filgrastim, which you probably know by the brand name Neupogen. This one's all about knowing what the drugs specifically do. We just talked about epoetin alfa boosting red blood cells. Well, filgrastim is different. It's a colony-stimulating factor that specifically boosts the production of white blood cells, called neutrophils. So if you see neutropenia, which literally means low neutrophils, you need filgrastim. All right, moving on. Next question. Which condition is most associated with macrocytic anemia? Your choices are A, iron deficiency, B, vitamin B12 deficiency, C, chronic kidney disease, or D, lead poisoning. Pause and think this one through. And if you went with B, vitamin B12 deficiency, you nailed it. The name itself is a huge clue, right? Macro means large. So in macrocytic anemia, the red blood cells are actually bigger than they should be. This is usually because of a deficiency in either vitamin B12 or folic acid. It's the total opposite of iron deficiency, which causes microcytic or small cell anemia. Okay, last question for this section. Hydroxyurea is used in sickle cell disease primarily to do what? Your options are A, increase iron absorption, B, increase fetal hemoglobin or HbF, C, treat B12 deficiency, or D, lower platelet count. Pause here and make your choice. And the correct answer is B, increase fetal hemoglobin. Here's how it works. Hydroxyurea actually boosts the body's production of something called fetal hemoglobin, or HbF. This type of hemoglobin is really good at stopping the red blood cells from twisting into that sickle shape, which is what causes all those painful crises in sickle cell disease. It's a real game changer for these patients. You guys are doing great. That's it for Section 1. Now we're going to jump into our second topic, anticoagulation agents. Hey, and if you're finding this helpful, just take a quick second to subscribe so you don't miss out on any of our future prep guides. All right, you ready? Let's dive in. Here we go. Which lab value should be monitored when a patient is on warfarin? Is it A, APTT, B, INR, C, platelet count, or D, hemoglobin? Go ahead and pause and pick your answer. The answer is B, INR. Okay, this is huge. You absolutely have to know this for the exam. Warfarin is monitored by INR, and heparin is monitored by APTT. They love to try and trick you on this. A silly way I remember it is you go to war, so you want to win, right? W-I-N. Warfarin, INR. Whatever works for you, just don't get them mixed up. Next up, which medication requires vitamin K as an antidote? Your options are A. Heparin, B. Warfarin, C. Clopidogrel, or D. alteplase. Take a moment to think. And the answer is B, warfarin. And this one makes total sense if you think about how the drug actually works. See, warfarin's job is to block the clotting factors in your body that need vitamin K to work. So if you need to reverse it, what do? You just give the patient the very thing the drug is blocking, vitamin K. Simple as that. Okay, here's a little clinical scenario for you. A patient develops HIT, which is heparin-induced thrombocytopenia. What's a safe alternative medication? Is it A, enoxaparin, B, argatroban, C, warfarin only, or D, ferrous gluconate? Pause and consider this one carefully. The right answer here is B, argatroban. Listen, this is a super important safety point. HIT is a really severe reaction to heparin, and enoxaparin, which is Lovenox, is a low molecular white heparin, so that's off limits too. You have to switch to a totally different class of drug like a direct thrombin inhibitor, and argatroban is a perfect example of that. Okay, let's put on our pharmacy tech hats for this one. A tech should alert the pharmacist if a patient on warfarin also picks up a prescription for, what? Is it A, amoxicillin, B, acetaminophen, C, a vitamin K supplement, or D, omeprazole? Go ahead and pause. Yeah, the huge red flag here is C, the vitamin K supplement. This is a perfect example of the vital role a technician plays in patient safety. We just talked about how vitamin K is the antidote for warfarin, so if a patient takes them together, that supplement is going to completely cancel out the drug, putting them at a super high risk for a clot. Spotting this is a huge catch. All right, let's wrap things up with a quick definition. Thrombocytopenia means what? Is it A, low red blood cells, B, low white blood cells, C, low platelets, or D, low hemoglobin only? Make your final choice. And the answer is C, low platelets. Let's just break the word down. Thrombocyte is just the medical term for a platelet. And that ending, penia, means you have a deficiency or a low count of something. So put it together, and thrombocytopenia literally just means a low platelet count. And of course, that's a big risk for bleeding. And that's it. You made it. Great job getting through today's quiz. If this was helpful for you, please subscribe, hit that like button, and maybe share it with some friends who are also studying for the PTCB. Seriously, keep up this kind of practice and you're going to crush it. Good luck.